Good afternoon, everyone. I think it's afternoon for everyone. I don't think there's a good morning right now for everyone. I'm getting used to the new Region 1. Welcome, everyone. My name is Tony Gwen. I'm the Executive Director for the Network of the National Libraries of Medicine for Region 1, and I do see a couple of my colleagues as well. I have MJ Tui on screen, as well as with Kiri Burkett. I believe there may be a couple of additional people. April Wright is with us as well, and I believe that might be it from Region 1 right now. So for everyone who's able to join us right now, I really appreciate it. And I wanted to give you a review of some of the content that we've shared previously when we had the MLA open house, but also give you some insights as to some of the additional projects that we have going on as we go into the new cooperative agreement for the new NNLM. So as you might be aware of, there is a new NNLM regional structure, and Region 1 consists of Delaware, Kentucky, Maryland, New Jersey, North Carolina, Pennsylvania, Virginia, DC, and West Virginia. Please take a look at the NNLM workbook. This will have a lot of information that you might find helpful to help understand the new regional structure and where some people who you may be familiar with the Mid-Atlantic region, where they might be as well. So I just wanted to make sure that that was shared with everyone. I wanted to introduce everyone in the NNLM Region 1 team. We have Colette Boyu, who is our office manager. Kiri Burkett is our health literacy librarian. Regina Johnson is our program management specialist. And actually, she will be retiring at the end of this week after 40 long years at the University of Maryland, Baltimore. So everyone, please congratulate Regina if you know her. I'm the executive director, as I mentioned earlier. And then we have Nancy Patterson, who is our health equity and outreach librarian. MJ Tui is the RML director. April Wright is our environmental health program specialist. We also have two positions that we hope to announce probably within the next 2 or 3 weeks. We have an outreach and education librarian position, and then a data management librarian, which will also be posted pretty soon as well. If you are interested, the University of Maryland, Baltimore is also hiring 3 new positions to support the NNLM Web Services Office. That includes the head of the NNLM Web Service Office, and that will be a faculty librarian position, while the other 2 positions will be support staff jobs. So if you're interested in that, let me share a link for you in the chat box. So Region 1 has a department-wide email, and we also have social media accounts to help engage with our current and potential members. So I'm going to go ahead and share that with you right now. Our email is a shared account. So even if I'm on vacation, anyone who works in Region 1 should be able to see that email and can respond to you within 1 to 2 business days. And then there's also our social media. If you're interested in some of our new programs and activities, we have been sharing that both on Twitter as well as on Facebook. We've also subscribed to a number of various listservs to help communicate to our members and non-members as well. And you may be hearing from the NNLM on various state and health science library association lists, MLA chapters. I believe we're also a part of HBCU Connect and various different community outreach organization lists. This fall, we're actually going to be very selective in terms of conferences that we will participate and exhibit at, if at all, in all actuality. However, we will be exploring conferences that start in 2022 to exhibit at. So we're currently looking at that, but we hope to be able to participate in a number of conferences over the next 5 years. Additionally, as we plan to exhibit at various conferences, our goal is to also submit applications to the conference organizers to possibly present or teach at these conferences as well. So we hope to look at different CNE or CE opportunities down the line. So that's another area that we hope to be involved in. Announced just last week, our new NNLM.gov website was just launched. So there are a lot of new features that you're going to notice as you log in. And the one thing to keep in mind is, as an NNLM liaison or account person, you do have to reset your password. So if you have an account, just go into nnlm.gov and you should see a login button. And from there, you should be able to reset your password. If not, I provided a link for you into the chat box so that you can go to that and get instructions to reset your password. I think if you submit your email address, you have about 5 minutes to click the link and reset your password. I could be wrong. If you do not have an account at all, and an account you generally use to sign up for any of the free webinars or classes that we have available, if you don't have an account yet with us, I've provided a link for you to create your free user account. And then also, I would encourage your organization that you may be working at, if you're not a member, to become a member, and that is free for you as well. There are a number of benefits to having your organization be a member, and I'll share some of those a little bit later. One thing that we needed to do before the new website was launched was we needed to find some way to communicate with all of our network members that we could identify. And with that, we connected with an organization called Constant Contact, which sends out glossy newsletters. And the newsletter has been going out. I think we've only sent maybe 3 or 4 newsletters, and we've called it Region 1 Insights. If you have not received it, you are more than welcome to read our latest newsletter. And I'll share that link here. And if you are interested in subscribing to this newsletter, I'll provide a link for you here so that you can subscribe as well. Please note that this is just an interim newsletter subscription that we may have, and it may last until the end of August in all actuality. I know that there are a number of hospitals and other organizations that cannot get this email, and there are firewalls that prevent them from clicking on links as well. So I am well aware of that, and actually what we're doing is, with the new NNLM website, there is a program in there that is called CVCRM. It's a customer relations management tool that allows us to create emails. So I just got access to that last week, so I'll be exploring that a little bit further and creating some news templates so that we can email everyone in the NNLM database updates. So it won't go to the select people that I was able to pull from the previous website. So hopefully you'll start seeing some communications from us, and you'll get updates related to all of our training and education opportunities that we hope to announce probably within the next few weeks. You haven't seen any education yet, but that will be coming out fairly soon. Over the summer, we've started our first big social media promotion, which is a tour of Region 1. We wanted to get to know this new region, basically, and we wanted to engage and unite all of our network members. So what we've asked people to do was to share photos of their favorite place within their state, their city that they work in, or their library or place of work. And if you use the hashtag Region1Tour, you are and tag our office on our Twitter or Facebook accounts, you'll be entered into a raffle, basically. And with that raffle, we're going to cover your registration for a fall conference that you're interested in attending that you haven't signed up for yet, and we'll cover those costs. It'll be for up to $2,000 that will cover that registration fees for. So if you haven't participated or shared anything yet, please be sure to do so. We'll probably run this contest through the end of August before we do a drawing. So you have about a month or 5 weeks left to participate in this social media engagement. Just checking chat constantly to see if there are any comments that come through as well. So Region 1 has this governance structure that consists of a Senate, communities of interest leaders, the Library Advisory Board, and Disaster Preparedness and Emergency Response Advisory Council. So the Senate will represent the voices of their communities. And what we intend to do with any of the senators is to provide train-the-trainer instruction so that they can be trusted ambassadors in the field. And they can provide outreach and education to the underrepresented populations within the state. This is not a volunteer kind of position. We do intend to pay the senators for when they're providing these instructional sessions. And that's something that we would discuss with the senators should they be selected for those particular roles. The communities of interest leaders are topic experts, and they'll be ideally related to NNLM priority or NNLM initiatives. And it could also be emerging topics. And what the goal for these leaders is to help shape the educational offerings that NNLM provides. So they can help with evaluating and improving our programming. And we basically want these leaders to reflect the region's emerging needs, any trends that they've identified, and address any particular issues. So if there's someone that was really interested in helping NNLM with providing programming towards graphic medicine, for instance, you can be a volunteer to serve as a communities of interest leaders. There are a number of different topics that we list, and but at the same time, we did not want you to feel obligated to participate in any of those. You may say to yourself, I want to be a leader on this other topic that I am aware of, and I want to share more information on. So if you're interested in being a communities of interest leader or a senator, you're free to sign up in the link that I provided for you here. We also have a library advisory board, and this would consist of not just health sciences librarians. I hope to include hospital, medical, public, special library leaders into the lab, if possible. And their goal is to help provide guidance on developing, evaluating programs to help meet the needs of librarians within Region 1. So hopefully, if you are interested, you can sign up for that as well. And finally, we hope to have a disaster preparedness and emergency response advisory council. The DPAC will inform the RML of different regional disasters, whether they're environmental or human-made, assist with any potential course development that they feel is missing, and expand the continuity of operations procedures for all libraries, and maybe expand it even further to community-based organizations as well. So, additionally, all members of the Senate and select members of both the Library Advisory Board, Communities of Interest Leaders, and the DPAC will participate in the executive committee as well. So for participation in any of those that I've described, please feel free to fill out the Qualtrics form that I provided for you. And again, this will go till the end of the month, and we'll start reviewing all of the applicants and make some discussions or make some decisions or decide if we need to interview people if there are multiple applicants for a senator within a state. So we'll be reaching out to people who've signed up as soon as possible. So looking ahead, what I wanted to do is provide some information of things that we've proposed in our cooperative agreement and things that we hope to introduce to the region shortly. The first one is member insights, and member insights are structured informational interviews that are intended to understand both the individuals, the organizations, and the communities that they live in. So the coordinators and I will begin to conduct 3 to 5 interviews a month. And we hope to start this in the fall, if not sooner. And what I'd like to do is share a link that if you're interested in giving us maybe a half hour to an hour of your time to participate, I would love to have you fill out the form to participate in member insights. Additionally, our office is conducting a website inventory. And so one of our librarians, what they're doing is looking at our network database and looking at the network members and their websites and see how they communicate to your users about NLM resources. And what we hope to do as we're doing a deep dive is identify opportunities to increase the visibility of NLM resources on our members' websites. So we've already done some investigations initially, and I think we've reviewed 3.5 states already. So currently, Region 1, when we did our initial evaluation, is approximately 1,700 network members. And one of the goals is to increase membership. So the goal is to increase it about 15% each year to promote and align all of our activities to diversity, equity, and inclusion. So some of our approaches include integrating our membership enrollment in our regular activities, using listservs to attract network members, direct outreach to various minority serving institutions, non-government organizations, community-based organizations, as well as faith-based organizations, becoming more visible within the MLA chapters, and trying to engage as much as possible as well. Additionally, we intend to present at various conferences, whether they're poster presentations, paper presentations, or pre-conference CE options. We do intend to submit numerous proposals throughout the region, as well as with various national conferences as well. We also intend to do outreach to environmental health organizations, substance misuse prevention organizations, and then through other virtual engagement opportunities like the Region 1 tour that I mentioned earlier. We have a very robust training and education program that we intend to make available. Our coordinators are generally conducting roughly 60 training and outreach programs a year. The first year might be a little smaller, mostly because we are recruiting for 2 new librarians at this time. But we also intend to offer train the trainer programs for the senators, and those senators would be conducting roughly between 50 to 60 training sessions a year as well. Additionally, with our office, we'll be collaborating with the NNLM training office to support the training program. And the NNLM training program is broken into 5 different categories: clinical information classes, consumer health information, public health classes, data services, and information access. So those will all be interweaved within the offerings that the RML within Region 1 provides as well. We are also offering an end-of-life care pilot program. The program is designed for both public libraries and community-based organizations that partner with hospitals to supplement end-of-life care planning. And there will be a toolkit that's developed by the NNLM as well. The toolkit provides some guidance on sharing reliable resources and facilitating group or private discussions with a combination of patients, caregivers, and families. The goal is to interweave cultural humility within this program and cover topics such as the specific fears and anxieties surrounding death and end-of-life care, caregiver experiences, discussing important documents such as advanced directives, reliable online resources for information, and a guide for having productive and compassionate end-of-life care discussions. So that we test piloted this past spring, and we'll hopefully be able to offer it again this year. So I think the responses from the initial test pilot were very favorable. So we hope to continue this, whether on a regional, if not national level. Additionally, we are connecting with hospitals related to continuing medical education departments to engage with various health professionals during grand rounds, M&M reports, and other CME opportunities. And what we were thinking about was that it could also be thematic related to NIH initiatives like Unite. So that's another area that we are investigating. And then there's different community health topics. And what we intend to do, if there's any curriculum that we're asked to present, they'll be reviewed and adapted to ensure that there's DEI research, imaging, language, and whatnot integrated within the whole program itself. So there are various topics that we are looking at. Some include health data or numeracy, health numeracy, mental health, genomics or consumer health genetics, environmental health, as well as nutrition. In addition to teaching and training, we are looking at different curriculums that have already been developed and adapt them into new models, possibly. So the goal is to help engage and support in the development of future health professionals, whether they're currently high school students thinking about what kind of programs they want to pursue when they start going into their undergraduate career, or if we're going to look into undergraduates, two-year colleges, etc. The first one we're looking at is adapting a program called Project Share. And what we'd like to do is utilize this curriculum and have it be adaptable for AHECs to utilize. If it's not AHECs, I've seen them also referred to as county extensions as well, but they can be utilized to help with developing high school students and interesting them into the health professions. We were also interested in the SHOW curriculum, Students Health Outreach for Wellness, and replicate that program to provide some free access to healthcare and health education to underrepresented populations. So let me go ahead and share that curriculum as well for you, if you're interested in learning more about that. Additionally, we do support MLA specializations for all of our health sciences as well as our consumer health librarians. One thing to know is that, and I'm not sure if people are exactly familiar with this, but traditionally from the University of Maryland, Baltimore, who has been previously a regional medical library as the Southeastern Atlantic region, we have covered traditionally people who've participated in consumer health information specialization and disaster information specialization, we have paid for them to get that specialization so that you don't have to pay for it out of your own pocket. And we're going to continue that tradition of up to, I think, about 200 people a year for that. And we also wanted to include the specialization that just was announced, the data services specialization as well. So there are 3 specializations that our office will cover. If you're interested in learning more about that, please feel free to reach out to me and we can discuss if you are up to submit that to MLA. We have some procedures that we can follow to help cover that for you so that you don't have to pay out of pocket. A new program that was officially launched this year that the University of Maryland, Baltimore, as the Southeastern Atlantic RML partially funded, was a citizen science certificate program. This program is not available on MLA at all. But it is available for you to take on the edX platform, which is just similar to Coursera, if you're familiar with classes from Coursera. So it is a 5-module asynchronous course and has roughly about 15 hours of content and activity. And if you're interested in citizen science, or you know people who are interested in citizen science, or would like a refresher to basic sciences, actually, that course is available to take for free. But if you are interested in getting a certificate, we are exploring how we could also cover the cost so that you don't have to pay the $25 to get the certificate after you've completed the 5 modules. So hopefully we'll be able to make an announcement of when this MOOC will be available for us to cover the costs. But if you wanted to go ahead and take it now for free, you are welcome to do so. And you can also pay yourself, out of your funds, the $25 fee if you wanted to get the certificate. So in collaboration and consultation with a new NNLM Data Science and Services Center, we hope to establish a data science community of practice. Additionally, there's a project that we hope to launch later this fall called Data Challenges. And what we hope to do is connect principles of data science with concrete goals and practical data skills development. We also hope to launch data science workshops through library carpentry, and we also are investigating hosting NCBI hackathons and codathons. And if you've seen the University of Michigan, they've did a presentation at MLA this past spring on hosting hackathons and codathons. And we're going to identify a number of their best practices and see if maybe we can host a virtual NCBI hackathon as well. So the goal is to hopefully engage with health professionals, both affiliated and non-affiliated, researchers, data scientists, and those that may also be working with underrepresented populations as well. April Wright is also someone who will be supporting the DocLine program, and she is affiliated with the DocLine committee within the NNLM as well. So she's getting acclimated to understanding and utilizing DocLine and what the needs are from the region to support that program. In collaboration with the University of Virginia, we are connecting with Dan Wilson, as well as the American Libraries Association, to reach out to all libraries within Region 1 to plan and start promoting disaster information specialization, and also with developing the continuity of operations procedures at each library. So I think interest grew more recently due to a small global pandemic, but we also want to consider different weather emergencies as well, as those have also increased too. And more recently, human-made emergencies have been emerging too, and we want to be prepared for those too. We are also interested, and I know that Rob Mackus was part of the is attending, but we are interested in expanding the group licensing initiative from the HISLANG, which is a cooperative license negotiation program that helps hospitals afford access to a lot of health information. And I know that 70% of the participants are currently in Delaware, New Jersey, and Pennsylvania. So I'm hoping that we can continue this and help HISLANG with this program down the road. We are also working on developing competencies of the public health workforce in collaboration with the NNLM Public Health Coordination Office. And we'll be providing some information access, some training support, and document delivery via NNLM delivery to help circumvent the firewalls and email size limitations that that act as a barrier to information access through many hospital libraries as well. There is a, as you might notice, the NNLM is now referred to as the network of the National Library of Medicine. Beforehand, we were a different name, the National Network of Libraries of Medicine, I believe. The change is due to being more inclusive. However, this name change occurred during a global pandemic, and all of our material that we've had related to exhibiting is no longer viable due to a name change. So we are looking at designing some new banners and focused on outreach, education, and funding. The goals of our exhibiting will be to be sure that we're as diverse and inclusive as possible, looking at membership promotion and ensuring that we are promoting both NNLM resources and NNLM services as well. Previously, our office has funded and various network members, if they're hosting a health fair or a community event and they wanted to borrow our exhibits, we've loaned them out. And as soon as our banners are available, we intend to loan out our exhibits again, so that if you're hosting an event, we would have that available for you. A new program that we are implementing in this cooperative agreement is called TEquity. It's related to technology and digital equity. So we hope to develop a replicable program to deliver technology improvements in health and digital equity to communities that are impacted by the digital divide. The term TEquity I discovered recently through the Journal of Healthcare and for the Poor and Underserved. So I wanted to share the latest research that was published out of that journal related to TEquity, as it was what helped us in thinking about this a little bit further, because Region 1 has a large and diverse population, and there's also heavily rural populations that do not have the technology that might be available within some cities. And even within cities, inner cities also face a lot of technology upgrade needs as well. So we hope to follow along some replicable programs that we've identified. That includes the Harlem E-Project, which stemmed out of Georgetown, actually. And then we've identified the South Carolina Broadband Initiative as another program that was statewide, but there might be communities that would benefit in doing a smaller scale replication of that particular program. So that is one of the goals related to TEquity, and we hope that you'll be interested in learning more about this as it gets developed. Our biggest activity right now that you might be aware of is our funding program. Our call for proposals is still currently active until July 30th, which is this Friday at 5 o'clock. We're accepting applications. Because of the timing for the release of the new NNLM.gov website, we decided to have applications be provided through the University of Maryland's Qualtrics form. I know that there might be a number of institutions that cannot access Qualtrics, and this could be due to firewalls. So if you come across that issue, please email us. And I've shared that email earlier, but please email us the forms and applications. And if you need access to those forms, please let me know. I'd be happy to share those forms with you as well. So currently there are 4 areas that you can apply for funding. They are health information outreach, TEquity, data sciences and services, as well as with professional development. So again, the application is due by this Friday at 5 o'clock for first round consideration. If after the first round of applications we realize we did not award all of the monies, we will do another announcement for a call for applications later this fall, and we will make that available on nnlm.gov. So you will use the data reporting system to apply for that award then. So again, I've shared a link for that, and if you're interested, hopefully you can submit an application. If you have any issues, please email us and we'll be glad to find an alternative method for you to apply for these awards. Inspired by a book chapter that was co-authored by Emily Vardell and Deborah Charbonneau, they wrote Applying a Health Justice Framework to Examine Health and Social Justice in LIS Course Offerings. And as we read that chapter, one thing that we thought about was creating a social justice and health equity certificate program. We thought about this and proposed possible collaborations with the Medical Library Association, the American Library Association Office of Diversity, Literacy, and Outreach Services, OSL, and other RMLs and NLM offices and centers to help with defining the core objectives of this particular certificate program. We initially envisioned about 24 to 30 hours of course content, assignments, and activities that are reviewed and updated on an annual basis. And upon completion, participants are what we believed would happen is that participants would be equipped to understand their own identity and how their culture impacts the way they see the world, get a foundational, grasp foundational experiences of other identities and adapt behavior accordingly, apply a DEI lens in everything that they do, and provide they're equipped with tools and resources to promote unity and cultural humility across various age groups, promote health equity in support of both physical and mental health of underrepresented populations, equipped with a variety of ready-to-use tools and resources to learn more, conduct outreach, and advocate for causes and educate others, and utilize practical applications to advance health equity and eliminate healthcare disparities. So the goal of this curriculum is to not attract just librarians. We wanted this to attract educators, public and community health workers, community-based and faith-based organizations, health professionals, and students to support health equity outreach. So it's going to benefit more than just librarians. So when we thought about this further, similar to the citizen science certificate program that's hosted on edX, we thought that this certificate program may also be beneficial if hosted on a MOOC that might be developed from another university or college that's also equally interested in investing time and effort to develop this type of certificate program. So more information on this will be coming, but I wanted to at least share that with you as something that we'll be working on behind the scenes that you might not necessarily notice. Earlier this past spring, the NNLM hosted 2 virtual symposiums. The first one was Blossom, which was related to health and wellness of library staff and workers and faculty, as well as a COVID-19 infodemic symposium as well. They were both offered virtually. And building on the success and knowledge of those 2 symposiums, one of the things that we hope to do is collaborate with the other regional medical libraries, offices, and centers as well to continue hosting on an annual, if possible, if not biannual, virtual symposium. And the goal is to bring together a wider audience of professionals to learn, share, and discuss specific topics of interest. And the program would be to feature both keynote speakers as well as representatives out in the field and equip others who participate with resources, activities, programs, and partnership ideas as well. So we listed several different potential topics that we thought were kind of relevant as we were looking at the needs within Region 1. The first one we thought of was related to hospital libraries and promoting value. We also thought about what does the future of the library look like if they are a data-driven library. We also thought about social justice and health equity to reach underrepresented populations with cultural humility. We thought about TEquity, and then the future of work and building a diverse workforce. So those were some ideas, but we do want to consult with the rest of NNLM to see what they would like to offer. And hopefully we would come to a consensus of a project that we can work on an annual, if not biannual basis. A big project that we are investigating, and April Wright will be spearheading, is partnerships with environmental health organizations to promote environmental health equity. This would include education related to emergency and disaster preparedness and planning, engaging network members to achieve their MLA DIS certification, and develop COOP plans with a buddy organization. And lastly, a course that April is interested in developing is environmental health in the community. And that's something that we'll hopefully propose to be offered on a national level. If you have some expertise in environmental health and would like to be a part of this, please feel free to reach out to April Wright. I'm sure she would be glad to hear from you to help with developing this course as well. So April, if you're still here, if you have time to put in your email address, that would be great. Thanks, April. Aside from the regional partnerships that we intend to conduct, we also often investigate a number of different cross-regional, if not national partnerships as well that could benefit NNLM, especially if they have similar goals. So there are a number of national organizations that we have identified and we proposed reaching out to them. That includes the Black Barbershop Health Outreach Program. They're also affiliated with a group called Black Limbs Matter and the Black Salon Health Initiative. So we'll be reaching out to that group. We'll also reach out to Remote Area Medical, and Remote Area Medical provides pop-up clinics for free. And they provide free healthcare. And what we hope to do is partner with them so that they have some of the resources from the NNLM as well. We also hope to do partnerships with various AHECs and county extensions to help with community health education programming. We will also look at investigating partnerships with Black Girl Health, various faith-based organizations, a group that we've worked with in the past, South Central Educational Development. They're located in southern West Virginia, and they've actually expanded further to be a state-level outreach organization, mostly focused on HIV/AIDS, but they've expanded to substance use disorder and other areas. So we hope to see if what they're doing could be replicated in other states within Region 1 as well. And then we've also identified a another group called Creating a Culture in Health in Appalachia. And what they do is kind of interesting. They create bright spot communities, and what those bright spots are is they've been known to have better than expected health outcomes. So we hope to spotlight them as an organization so that maybe a lot of the communities that they highlight, their activities could be replicated in other communities as well. What we also intend to do is to constantly assess a number of our activities. So what we hope to do is work in close collaboration with the NNLM Evaluation Center, as well as the Region 1 governance to do an evaluation. We hope to do this starting this fall, and the goal of this is to provide the best possible NNLM Region 1 program possible. And in order to do that, we want to continually meet the needs and evolve with those needs as well. So what we've proposed that I shared with you might not be what is identified within Region 1 as well. So we need to see what the balance is of meeting the needs of the region, as well as what others might see as a need as well. So we'll hopefully continually be able to conduct region-wide evaluations to assess those needs, address various trends that are identified, and adjust our program. And the goal will be to continually shape the Region 1 RML program. So that is that. And I will open it up to any questions that people have. And I will also be happy to share both my email address if you'd like to email me later. And then I have also shared with you my Calendly account. And what Calendly does is it gives you access to my availability in Outlook, and you can schedule a time that works with you, and it will automatically schedule a Zoom meeting so that we don't have to like go back and forth and then I have to slowly schedule that meeting. It gives you that opportunity to automatically schedule time with me. And it notifies me in my email, so I know that someone out there is interested in talking to me about something. So are there any last minute thoughts, questions, anything I proposed that you'd like to have more information on? You can use the chat if you'd like. Let me do a stop share as well. But I wanted to give everyone an opportunity to share if they'd like. And you should be able to unmute yourself as well. I think I gave permissions so that if you wanted to do that, you are more than welcome to unmute yourself too. Also, I wanted to thank MJ, Kiri, and April for participating. I really appreciate that as well. So.
Tony, I'm just going to add my welcome to yours. We're delighted to see so many people here. I think we had 49, maybe more than that. And we're excited to be Region 1. Couple quick things that I just wanted to mention about two things that Tony mentioned. One was Project Share, and that's a project that has been in existence since the mid 20-teens, I guess 2013, 2014. But it is a modular program to work with high school students. And as Tony said, it stands for Student Health Advocates Redefining Empowerment. And it's not just about NLM resources. It's not just about, all the things you'd expect, but, that you might expect to do with students, but it talks about how to develop them as communicators, how to develop them as advocates. It's got social determinants of health. And I think the thing that's powerful about it, if you're working especially with high school students or want to work with high school students, is that you can take the modules as they are and just lift them and just use one module. You don't have to go through all the program. You can take whatever module you want. And I know that there are hopes. I can't say there are plans, there are always hopes. There are hopes that we are going to be adding some additional modules to share to deal with things like violence and everything else. And it was used by the National AHEC Center in tribal lands and in cities. And there's actually a couple articles about it if you look up Project Share in PubMed Central. So there's more about that. And then the citizen science class. See, I know about these things because they were developed here at HSHSO. But well, actually, this isn't here. This is my office at home. So anyway, the citizen science course was just released this past April, or maybe it was May, I don't know. And it's also, as Tony said, on edX. And the thing about it is it was developed for citizens, not for scientists. So it helps introduce, live people, like us, like the people we work with in the community, to the concepts of citizen science, like how to collect data, what makes a good project, et cetera. And that has been that was quite a project. So if you can use that in any way, shape, or form, it's all free out there for you to use. And again, I can answer questions too if you have any for Tony.
So Karen Martinez writes, how soon will this recording be available? And you've unfortunately missed a little bit at the beginning. So as soon as I'm done recording, I have to figure out Zoom and how to download the recording, and then we will upload it to the NNLM YouTube channel. So once that's available, I have to access the transcript and everything as well that Zoom has gloriously auto-transcribed in its unique fashion. And then we have to compare what is said and edit that to fit with the transcript. And once that's available, we'll hopefully make it available, if not by the end of the week, sometime next week. It should be up and available for everyone to access. Did any of the symposium topics jump out at you?
That was me, Tony. I just figured
Yes.
while we had people here, if they had thoughts, they could share them.
Oh, that was a
If not,
question
that's
for
fine
the
too.
group. That
Yeah.
would be a great question to see if the group was interested in any of the particular topics that we had mentioned. And if you are interested, let me see if I can find that slide and I will share my
I have
screen.
it up. I can copy and paste it. But
Or any other topics that you might suggest. As the symposia that Tony mentioned, the Blossom one and the Infodemic one, were very well attended, hundreds of people. And it's a great way to do some cross-regional cooperation. But we want them to be relevant. We don't want them to be just things we say should be done.
Oh, thanks, Kiri, for sharing that.
Thanks, Kiri.
So these were the areas that we had mentioned, hospital libraries. And actually, if we expanded it to beyond hospital libraries, it's just library advocacy as well. So it could be related to library advocacy. The role of a data-driven library, social justice and health equity, TEquity, and building a diverse workforce. So if any of those interested you, I'd love to hear what the attendees' thoughts are as well. Lauren says that TEquity sounded interesting and would be interested in learning more about that. Lee was interested in the Library of the Future, and it's important to think about what it means to be more data-driven. Diane was interested in both TEquity as well as social justice and the library of the future. Karen was interested in the social justice and health equity topic. And just as an FYI, I know that Nancy's not attending right now, but one of the things that I tasked her with, since it's kind of like a new area of focus for us related to social justice, I've asked her to explore various speakers that maybe as we're developing this course, we can also have different webinars from social justice experts on this particular topic area too. So we hope to make that available. Andrea is interested in library advocacy, struggling to find ways to promote services to hospital staff. Thanks for letting me know that, Andrea.
And Tony, also Jacqueline was interested in investigating the social justice and health equity program.
Oh, okay,
Yeah.
thanks. I missed.
Goodbye in chat real quick.
Thanks, Jacqueline. I apologize for missing you on that one.
It's interesting about the library advocacy one for those of you that are hospital librarians and on the hospital library list for MLA. You know that that was a huge topic about a month or so ago based on what the Canadian Health Sciences Library Association issued as a statement in terms of advocacy. So I'm always interested to see if there are synergies, not only among the RMLs, but also with projects that MLA is working on, and certainly I think that's something that's been a hot topic. The other thing is there's Helen Ann, I think, had to leave, but Helen Ann and I are both on a task force, a 3-year task force for MLA that has to do with MLA like 2048. You know, what are we going to look like 25 years from now? And so a lot of these topics hopefully will mesh with that as well. And I intend to listen very carefully when we have these conversations. So think about what the future of health sciences libraries, medical libraries, hospital libraries looks like. When I think about what we looked like 25 years ago, and try to project what we might look like in 25 years, it's somewhat of a daunting task. So anyway.
We looked nothing like 25 years ago, I don't believe.
I don't think there was e-journals 25 years ago. I don't know. I don't remember. It's been a long time.
Hi, this is Fatima. Just to whet your appetites, the Law Library and our library at Howard University will host a 20th anniversary in September of our libraries in the new buildings. And we are going to have a 2 half-day symposium, and with the title of Challenges and Legal Implications of Misinformation in Health Disparities and Health Policies that Affect Minority Groups in the US. And our keynote is Dr. Robert Peel, the author of Mistreated and Uncaring, How the Culture of Medicine Kills Doctors and Patients. He's at Stanford. So it's a very exciting program. We've organized one day with 3 panels of speakers. One will talk on, and all of them will talk on their publications. A professor from GW will talk on misinformation mayhem, social media platforms' efforts to combat medical and political misinformation. And we have a PhD student from MIT that will talk on the biasness of searching for information on race and health disparities. And one of our own from the communications will talk on the interdisciplinary model for healthcare crisis communication. So I hope it's a free symposia, 2 half days. We'll send you invitations and hope you can attend. But I believe we're thinking along the same wavelength of just injustice and healthcare disparities.
So thank you for sharing that, Fatima. If you can email me that, I'd be happy to share that in our communications that we send out to the region too. So please feel free to do that. And I also encourage others who are listening that if you have an event that is open to all, I'd be happy to include that as well. We're trying to figure out all the weird things within the new NNLM.gov system to see what we can do so that there could be some more sharing and collaboration and communication of events that happen locally, but are not restricted to being a local event as well. So if you can send that on, I'd be happy to share that through both our social media as well as through our newsletters that we send out too.
Tony, I came into it a little bit later. You talked about the name of our blog and everything, right?
Yes, well, it's the digest currently, but we'll
Yeah,
probably be using it.
whatever it is, yeah.
Yeah, it's currently called Region 1
Insights.
Insights. I'm tired, it's Monday. But it's Region 1 Insights, or if you want to think about it, ROI, which, as many of you might know, is a return on investment. And we did that nameplate specifically because we are government funded, basically, and we want to return and make sure that you felt that we were investing within the region properly. So we hope that you've enjoyed this presentation, and thank you for your time. I really appreciate it. So
Thanks, everybody. Good to see you.